welcome to this really important session. We've got myself, Sheena Byram. I'm a midwife. I've been a midwife since the 1970s, actually. And I'm the co-owner of All for Maternity, which is an organisation that supports and nurtures midwives, as well as providing information, relevant information in an accessible way, but also not just for midwives, but for maternity workers. And would you like to introduce yourself, Marie-Louise?
Yep, so I'm Marie-Louise, also known as the Modern Midwife online. I did briefly mention before, I am a qualified teacher. I've got a hypnobirthing diploma. I've practiced midwifery internationally. And I actually failed to mention the first time round that I've got 2 best-selling books that have both been published by Penguin Random House. They are aimed at women, The Modern Midwife's Guide to Pregnancy, Birth and Beyond. And then my second book is The Modern Midwife's Guide to the First Year. I also work alongside Activiion, and I'm one of their pregnancy advisors, and that gives me the opportunity to have a range of roles, and I do things like write white papers for Activiion that you will find on their website too.
Wow, that's brilliant. Thank you so much. And you do lots of other things as well, because I see you on a regular basis providing support and information via social media. And I know that you've got a huge following and that people really trust what you say and do. So that's fantastic. And it's really great to be here with you in this space. And hopefully we're going to be able to be of some help to midwives and maternity workers when they're doing their busy jobs. So we want this session, just the title is Promoting Health and Wellbeing for Pregnant Women and Those Who Care for Them. And that what we're going to cover today is we're going to look at the physiological and emotional impact of pregnancy, general well-being of childbearing women and birthing people, and maintaining health and promoting well-being. And I think those 3 kind of items we're going to cover quite a lot in that. But just to kind of say at the beginning that both Marie-Louise and I absolutely understand if you're a midwife listening, or a student midwife, or you're a maternity worker that's working currently in NHS services or anywhere at all, that we completely understand how busy you are, and we know that time is limited. There's staffing constraints. There's also what's happening in practice is you're having to do a lot more kind of information giving and tick boxes. So we understand that. And so what we hope to do during this session is provide some information as a recap. So I've learned loads doing the research for this session. I've learned quite a lot, and I thought I knew everything about these topics. But hopefully we can give it to you in a way that easy to understand, and just as a recap, because you probably know most of it already. Is there anything you wanted to add there, Marie-Louise, about just the introduction?
Yeah, no, that's it exactly. It just reminded me of something my dad always says to me: the more you know, the more you realize you don't know. And I think that is the beautiful thing as well about midwifery, is that it's ever evolving. You're constantly learning, and that's why I continue to find it so interesting.
Yeah, really, truly. And as I said earlier, that being a grandmother, because I'm a mother and I'm a grandmother, and it's great for me to kind of keep up to date with everything that's going on and know the evidence around wellness. And I think it's something that I've learned to appreciate more and more the older I get, the importance of feeling and being well. So just as a reminder to everyone about the potential impact of pregnancy, both the physical and the emotional. And before I kind of talk a little bit more about each area, I just want to say that most of these are interlinked. And one sort of bullet point that you can see here, for example, sickness and nausea, impacts on the emotional changes as well, in the emotional impact of pregnancy. So each one you can kind of they flow between each other, because when you have one thing, it can impact on the other. So for midwives, just remembering that all these things are these physiological and emotional things that happen during pregnancy. Women are going to be coming to you all the time telling you these things, and you'll know them already, but it's just a reminder that sickness, for example, at the beginning, sickness and nausea during pregnancy, which is often referred to as morning sickness. They're common symptoms and mainly occurring straight away in the first trimester. I remember having this myself, and I was working as a midwife at the time, and it was absolutely awful. And the causes of the sickness is the fact that you have a rise, a hormonal increase in HCG, human chorionic gonadotrophin, which really is an indicator that the pregnancy is secure. So you do have that nausea that often is heightened when you smell food. So women will tell you that they can't eat, which sometimes impacts on their well-being because of the fact that they're not eating as much and feeling off, so they could lose weight, and it makes them feel tired. So it goes on to the next item, which is tiredness, because that can kind of impact on it. But one of the things we have to remember as midwives that when for most women this pregnancy sickness disappears around 12 to 16 weeks, for some women it doesn't. And hyperemesis gravidarum, which is obviously a very severe condition that affects about 1% of women, and this can lead to hydration, weight loss, and nutritional deficiencies, and require medical interventions such as hospitalization sometimes and IV fluids. But again, this condition really impacts on the emotional well-being, because I've got friends who've had this condition and they've felt really seriously depressed. So we have to be alert to that. So whilst as midwives, we have to kind of remember that this is a physiological process of pregnancy, that it can become much more severe. So sorry, did you want to say anything about that, Mary-Louise?
Yeah, I was just going to mention there was a study done about 18 months, 2 years ago into women's experiences of HG, and in particular, the significant association between HG and antenatal and also postnatal depression. So when I first started my practice, we would say, oh, she's got hyperemesis, put her in a side room, cannulate, put up fluids. And, we do all of the clinical and the physical things, but quite often, and I think it probably is because of lack of time as well, and perhaps even lack of education, we wouldn't always address the psychological impacts of certain conditions such as HG, and not even just, HG. Regular nausea and vomiting can have significant psychological impacts and on women and their babies. So so I just wanted to mention that study because it was a really interesting read.
Very important that you've mentioned that. And again, there is this time constraint, but it's remembering that there can be this impact. So thanks for that. Thanks for that, Mary-Louise. So tiredness again, so you can see how one thing would impact on another, and the tiredness comes just as a recap. The increased level of progesterone, which helps to maintain the pregnancy, can make women and people feel sluggish. The progesterone relaxes the muscles and slows down bodily processes, so you feel exhausted. And with the baby growing at the beginning, the new kind of the little sort of fetus growing inside can also impact on that. So the increased blood volume, by 30 to 50% of the blood volume increases, which and that's important to supply oxygen and nutrients to the baby, but it puts extra work on the heart, and of course that can cause heart palpitations, which is one of the other topics, and lead to fatigue. So lowering blood sugar and blood pressure, blood sugar levels can really dip during pregnancy, and that can make women feel really tired. And of course, the sleep disruptions, again, that's one of the emotional changes. So you can see how each kind of area impacts again on the other one. So the pregnancy brings significant physical and emotional changes. So women can very often swing from excitement to anxiety. And that the mental stress of pregnancy can cause women to sleep less, to have sleep disruption, and therefore feel really, really tired during the day. And if it's a woman's first baby, that anxiety can often be heightened due to fear of birth. And if it's their second baby or third or subsequent pregnancies, then there's the impact of the other children and the inability to be able to catch up on sleep. So it's just kind of remembering that. Anemia during pregnancy. So many pregnant women develop mild anemia due to increased iron demands, and low iron levels can reduce oxygen delivery to tissues, making the fatigue worse, which we'll come on to what we can do about that later in this session. So when the fatigue's usually more intense at the beginning, and I can remember myself feeling like I'd been drugged and like I just had to sleep all the time, and that kind of went towards mid-pregnancy, and then it came back in the 3rd trimester. So, remembering that there can be sort of a bit in the middle to reassure women. They can have some reprieve, but then it can get worse later on during pregnancy because of the growing baby and the inability to get comfortable, especially at night. So the lack of sleep can come as well because of wanting to go to the toilet a lot, getting up to wee. That can be due to the hormonal changes in early pregnancy, and then the pressing baby in later on as the pregnancy advances, because the baby's pressing on the bladder. So that can disrupt sleep as well. So can you see how each one can cause a change? So the digestive system is slowed by progesterone, and that can sort of sometimes cause sickness and nausea, but also can cause constipation and feeling of uncomfortableness, when women eat food. Sore breasts due to the hormonal changes. That's another thing that we can kind of, reassure women that that's due to the hormones. And aches and pains, particularly back and ligament joint pains due to the hormones again. So these hormones have a lot to answer for, but they're there to sustain the pregnancy, as we all know, and they're very often a really good indicator that the pregnancy is going well. But we always have to be alert with these changes, that it can mean something else, and we've also got to be alert that these changes can have an impact on the emotions and the psychological, be a psychological impact on women's and birthing people's feelings and how they're dealing with the pregnancy. And again, thinking about the national reports, the CMASH reports, knowing that actually there is a significant impact on suicide. So women are, the depression is really, really, it's critical that we understand the causes of depression, and being aware all the time that this is something that women can get so down that we have to be aware of that and alert and refer as soon as possible. So heightened emotions, both positive and negative, that's kind of always going to be sort of a flux between the two. Feeling of vulnerability and overwhelm, especially with primary gravid women, feeling like what's going to happen, being unaware, being fearful. I think fear drives a lot of the emotion that's going on now with pregnant women and their families. Worried, they're hearing lots of things that are going on in the news about negative things around maternity services, and that can impact on their feelings of vulnerability and how are they going to cope, and what's going to happen when they go to the maternity unit. And you'll know a lot about that, Mary-Louise, because you're in constant contact with pregnant women and people, aren't you, on your social media channels? And I'm guessing you can feel that as well from their questions that they're asking you.
Yeah, absolutely. And I think part of that it was increased recently as a result of the CQC report and the several other reports that have come before that have been quite damning towards maternity services. But the things that I often say to women to help them is just remind them that it isn't all doom and gloom. I had a baby a year ago myself within the NHS and had I couldn't have asked for a more positive experience. My care was, outstanding, gold standard. And the other thing as well is it's really important for women to really educate themselves on where they are choosing to have their baby. So, for example, we have various different cultural beliefs and societal beliefs about birth, and they vary tremendously. So you know, in order to achieve individualized care, part of that is women identifying that with you and for you. And so I often say, what is your expectation of birth? Because some women want a medicalized birth. They feel comfortable with a medicalized birth. And it's not necessarily my job to talk them out of that. You know, we can explore other options, and I can explain to them about physiology and how to work with their physiology and all the things that I'm passionate about, like home birth. But ultimately, if that's where they feel comfortable, that's where they feel comfortable, and that's their decision. And then you have, you know, women who would like to birth at home, for example. So I think it's really important for women to identify for themselves where they feel comfortable, and look at the hospital unit. You know, for example, if you want a more medicalized birth, are you better off going to a certain unit whereby perhaps they do have a higher cesarean section rate, for example? I know that sounds like a funny thing to say, but if that is, you know, where you perceive your birth to go, then that is perhaps a hospital unit that you may want to look at further. If you want a home birth, maybe you want to look at a unit that supports home birth, that has a home birth team. So yeah, I think it is important for women as well, and for you to, you know, for us to work with them to identify what it is that they want to achieve from birth, and then we can have a more positive shift towards looking at that, rather than going, you know, oh, no one's got enough time, we haven't got this, we haven't got that. Well, what do we have, and where can we support you to have a positive birth?
Perfect. And really, when you think about just asking women to identify what it is they're worried about, and then addressing those concerns is really important. So, you know, it's and I know that that time is limited, but one of the things that we have to keep reiterating is that there are plenty of other people out there to help with this information sharing, and that finding out yourself, you know, and directing women to other areas where to other places where they can get reliable information is really important, and I will come on to that later. So some of the things here that we've mentioned, that we're going to mention, is mood swings and tocophobia from previous birth trauma. We've kind of touched on that, but when women have had a baby before and they're fearful for that reason, then sometimes it's, you know, midwives say to me, well, it's really hard to spend enough, you haven't got enough time to go through everything with women. And if you haven't got enough time, it's important that you direct women to other places where they can get that information. And there are lots of charities out there where women can get support and encouragement. So Make Birth Better, for example, Birth Trauma Association. There are various charities that are out there to help. So you can't do everything as a midwife. You can listen and direct women to other parts of other organisations if you can't deliver that support yourself. But hopefully in the future we will be able to do that as midwives, and certainly, you know, it's really one of the things we should be doing. So it's not like we're trying to pass it on to other people, but if we haven't got enough time to provide the right support, we have to know where to signpost women and people to. Changes in the amygdala this was something that I kind of found fascinating when I started to learn about this, and it made me feel like I was a bit disappointed that I didn't know about this earlier in my career. That, you know, this tiny little part of your brain plays a significant part in how you feel, how you process your emotions and stress, and how you behave socially. And during pregnancy, it becomes more reactive, and because it responds to, it's sensitive to emotional stimuli. So it becomes more reactive, and it enhances our emotional processing, and it makes pregnant women more attuned to their environment. And there's a really good reason for that. It's thought to be preparing women for their childbirth experience, but also for caring for their baby and making them sensitive to their baby's needs. But sometimes it can make women feel anxious. It can contribute to the anxiety. So, you know, we have to be aware of that as well. But I think knowing about the amygdala and being able to tell women that and reassure them that that's actually a physiological change in pregnancy that's actually there for a really good reason. But just being aware that the feelings that they have don't tip over and into major depression, and that they get the right support at the right time, mental health services and medical support. So so that's kind of like part of the that I'm sure that if you're listening and you're a midwife, I'm sure you knew about all this, but it's just a little recap. So the potential impact of postpartum and physical and emotional impacts, the physical changes is impact of blood loss at birth. So depending on how much loss there's been, uterine contractions, after pains, particularly with second and subsequent babies, the after pains can be stronger and causing more discomfort. Wound care, if the woman's had an operative birth, or if she's got stitches, perineal trauma, breastfeeding challenges. And sometimes when I think about talking about breastfeeding challenges, I always feel it's a bit negative, because we're kind of saying that there should be challenges when sometimes there isn't. But certainly many women find learning to breastfeed and isn't as easy as maybe they thought originally, but getting the right support, and us again providing support. And if we can't do the physical support, directing women to other places where they can get that support, such as La Leche League, peer support workers, online support that there's plenty of, and also getting their families to, if they've got someone in their family or their friends who's breastfed successfully, to link up with them and get some good support. One of the things I wanted to say at the beginning of this is that if we can encourage women to think about the postpartum period in the antenatal period, and about these things that can happen after they've had their babies, the impact of having a baby, and encouraging them to get some support when they're pregnant, to kind of get it all sorted if they can, if they've got anyone available, either friends or family around them, just to help them during this period, is really, really important, and preparing for it is important. So, and breastfeeding is one of those areas. So organ movement, organs removing to their usual place and size. Not all, such as the uterus, returns to its pre-pregnant size, but understanding that that's all going on for women and birthing people. And extreme tiredness, fatigue, and sleep deprivation can actually impact on the emotional changes. Isolation, particularly overnight, and I think that Mary-Louise again will know more about that than me currently, but I remember that feeling, and I didn't have any distractions, no mobile phones or anything when I was having my babies, but certainly when I've cared for women, seeing that exhaustion can be intolerable. So again, it's direct, supporting women, listening to them, and sort of having the empathy and the compassion that is happening. Reassurance is really important, and again, signposting to family and friends that can help them, that can maybe cook a meal for them, would be really, really great. But we'll come on to that shortly in the next slides. Emotional changes, the isolation I've just mentioned, societal pressures to do it all and be everything to everyone. I don't think social media helps in that respect. See mothers like jumping back into their jeans straight away, or going back to work straight away. It's just sometimes overwhelming. And again, it's that reassurance from us as midwives. They don't have to do it all. They don't have to be everything to everybody. Baby blues, picking up on that, and postnatal depression is an integral part of our role. Again, sometimes it's hard with the constraints that we're under as midwives, but it's absolutely critical that we pick up the signs and symptoms of these conditions and refer on as appropriate, so that women do get the right help. Heightened emotions, which I've mentioned, both positive and negative. And again, that feeling of vulnerability and difficult accepting the new body image, all these things can impact. Next slide, please, Mary-Louise. So just some tips, really. Nourishing. So this is kind of us supporting women in their in their lives is just encouraging them during pregnancy to eat well. And this is influenced by this cultural impacts on cultural differences, we have to remember that there are the major differences between what some women would class as a healthy diet and what others would, and remembering that all the time. So when I was a midwife, we used to show this picture of a meat and 2 veg. Well, certainly not all people eat meat, and again, there are, you know, other communities wouldn't thank you for a roast beef dinner, for example. It would be more of a curry. So it's having that in mind when you're giving this information and encouraging. And one of the things I would really like to stress for midwives to be aware of, not necessarily that they've got the time to talk about this with the women that they're caring for, is the fact that the ultra-processed foods are causing so much harm to us as a human race. And so for pregnant women, it's even more important that they understand what ultra-processed foods are, and that you understand as a midwife. So reading books and looking online at what ultra-processed foods are. You can follow on social media, you can follow accounts that really go into that. And I think it's really critical that we understand about that, particularly for the microbiome and for wellness and health and well-being. So avoid irritants like smoking and alcohol. We all know as midwives what the impact of that has. So it's just reminding women about that without making them feel guilt, you know, it's sort of giving them loads of guilty feelings. And I think all this information that we give during pregnancy, it's really important that we try to do it in a facilitative way and not a directive way, that we're telling people what to do, and that we become very maternalistic or paternalistic in the way we deliver information. People have got every right to make choices, and they also don't need to be told all the time what to do. So all we can do is share the information in a way that's not directive, but just, did you know about this? Maybe you could look online about it, because as you know, we've talked about a lot, there are time constraints. So directing people to really good sources of information, because sometimes the information out there, particularly on social media, is very biased and not evidence-based. So again, it's just reminding yourself to kind of direct people to those right places. We have All for Maternity has an evidence-based platform that's free, that's called All for Birth, and we provide information on every topic for wellness during pregnancy and childbirth, and there's no strings attached, no bias at all. It's run by midwives and it's all open access. So when we're talking here, when this middle one, incorporating exercise and movement in your day-to-day, in women's day-to-day, talking about movement, it's just reminding them to maybe walk up a flight of stairs if they're able, or walking outside in the fresh air at least once a day, just getting some air. And then this sounds sort of, you know, very, oh yes, well, that's all right if you can, but you know, maybe I'm working full time. Well, then it's just asking if you can just go out for part of that your day, if you work indoors, just to get some movement, just to get some walking in. Monitoring and support positive mental health, which we've kind of touched on already. It's just acknowledging that it's overwhelming for some women being pregnant, and just being aware of the signs and symptoms and monitoring that as you go along. Stress management's really important, and again, giving tips for where to go to for help with that. So Marie-Louise has just mentioned that she's a hypnobirthing expert teacher, and so, you know, looking for ways to learn about hypnobirthing. You don't have to pay any money. You could borrow a book from the library. Women can borrow a book from the library, sorry. But you as midwives, knowing that there is that resource out there and that can help. It's really great if you have an answer to someone's anxiety. If someone tells you about their anxiety, that you have some tips to give them. So hypnobirthing would be one, meditation, yoga. So yoga does the both. It incorporates the exercise and movement as well as helping to support stress management. And you know, if you've got time to go to a yoga class and women can afford it, then that's great. But if women tell you they can't afford it, and you can see that they may be struggling, then there are loads of YouTube clips where you can direct people to if they feel they need to do something for their stress. So prioritizing sleep, so that's easy to say, isn't it, when someone's telling you, is in front of you and saying, well, I'm not sleeping very well. Encouraging them again to do the things I've just mentioned around meditation and hypnobirthing, but also trying to get some sleep during the day if they can, and taking naps. There's loads of really good evidence around how great naps are, even if it's just for 5 minutes. A quick nap is really great, and prioritizing your rest. Sorry, I keep saying your because I'm thinking about pregnant women now. I'm thinking that it's me talking to pregnant women, but yeah, just reminding yourself that you can, encourage women to take some rest if they can, but sometimes they might say I can't, and that's again really, really tricky. So encouraging women to come to the clinics, to the sessions, to the health checks, wherever they may be, and if they can't make it, then finding out a way that they can access services, because not everybody can make it. So, and considering recommended vaccinations is something to be aware of. Next slide, please, Mary-Louise. So for nutrition top tips, well, we've kind of touched on some already, especially around the food. So thinking whole grain foods, more vegetables than meat, lean meat if you do want to eat meat, fish and eggs, and pulses, really, really great for protein. So fiber-rich foods, again, whatever culture you're from and whatever food you eat, thinking about the foods that are fiber-rich within the type of food that you want to eat is really important, that women want to eat, and encouraging women to drink plenty of water during the day. Remembering that it's best for women to avoid unpasteurized milk, alcohol, and excessive caffeine. There's loads of non-alcoholic drinks now, and there are loads of caffeine-free hot drinks too. And avoiding a high sugar. High sugar in any shape or form is bad for all of us, but especially during pregnancy. So it's knowing about that. Healthy weight. Now then, this is really a hot topic, isn't it? Healthy weight is kind of something that I'm really interested in, because we see so much backlash from this in the media and social media. Women's experiences of feeling the pressure to not be heavy, particularly to be obese, which is a BMI of 30 or over. And it's kind of, as midwives, it's like everything is with the information that we share, it's not being non-judgmental and kind and compassionate in the way we deliver this information is absolutely critical. So when we talk about obesity or weight gain or heavy weight, we have to share information with women. It's like with smoking or with breastfeeding or with the type of birth they want. We always have to present them with the advantages and disadvantages, or the risks and benefits, whatever topic we're talking about. And just yesterday, I was reading, there's a report just being released of a review that's been undertaken in Northern Ireland, and it was in response to a particular birth where a baby was born in a midwifery-led unit, and the baby there was shoulder dystocia, and there was some discussion around the BMI of the woman who'd given birth. And so there was this review that's undertaken. Part of the review, the team of experts who looked into this case and everything else surrounding midwifery-led units looked at the care in pregnancy of women with BMI of over 30, best practice and women's experience. And to guide the review, they wanted to identify and summarise all the evidence around the experiences of pregnant women with a BMI of 30 and above. And what the review found was that actually the systematic review evidence identified that gestational diabetes, preeclampsia, gestational hypertension, depression, instrumental and caesarean birth, and surgical site infection are more likely to occur in pregnant women with obesity compared with women with a healthy weight. So there are all these kind of compounding factors, and not kind of knowing, not having everything to hand is, sometimes we don't know about this evidence that's just come out. So it's trying as midwives to ensure that we do look for this evidence, and especially the more recent evidence, that we can deliver this to women so that they can make an informed choice about the type of care and where they have their baby. So healthy weight actually, higher body weight impacts on the absorption of nutrients, and increased inflammation alters metabolism. So this is what Marie-Louise is just telling me. The risk of nutrient deficiencies are higher in women with higher body weight. So the really important point that, thank you so much for that, Marie-Louise. So these are just points that we want to kind of, bring up, so that you can, you're not going to have it all and be able to do it all at once, but it's just having that information at your fingertips. So I hope that's been helpful, and just as a reminder of all the things you probably knew already. So thank you, and I'm going to hand over to you now, Marie-Louise.
Thank you so much. And I love the way that you deliver information in such a calming way. So yeah, thanks so much, Sheena. So I'm just going to touch on some of the key nutrients during pregnancy. We'll be really familiar with this as midwives, in particular, starting with folic acid. Now, the recommendation has been around for the past 30 years, and I'm sure, we're well familiar with the dosage of being 400 micrograms supplement daily. It is important for us to differentiate the difference between folic acid, because that is synthetic, and folate, because that is in its natural form. And of course, it helps to prevent neural tube defects, and there's a huge body of research to demonstrate that. Moving on to iron during pregnancy. So as we know, blood volume increases by up to 50%. Sheena mentioned at the beginning there, creating an increased need for iron. So to be specific, for non-pregnant women, we need about 18 milligrams of iron daily, compared to pregnant women who need about 27. So you can see there's quite a significant jump up there, and it can be difficult for women to achieve that through diet alone. And we'll talk a little bit more about that later on. Then we have calcium and vitamin D. These two tend to interact with each other. So calcium is vital for the development of fetal bones and teeth. It also helps to manage maternal blood pressure during pregnancy. And if pregnant women don't get enough calcium through diet, then the baby will tend to draw it from their bones, and that can then impair mum's health later on in life. So that is an important one for women to be aware of. And then vitamin D. So this helps to maintain muscle and bone strength, and it also helps the body to absorb calcium. So that's why they kind of, work hand in hand. During pregnancy, vitamin D also helps to develop baby's bones. And again, if mum has a vitamin D deficiency, it can affect the amount of calcium that the baby then has in their bones. And this isn't related to midwifery or maternity, but I found it really interesting when I was researching vitamin D in general. So many oncologists report that their cancer treatments do not work, or they don't work anywhere near as well, unless the patient has adequate levels of vitamin D. So I just thought that was an interesting paper that I read most recently. So the importance of iron at each stage of life. There is a foundational need for women over a massive 30 to 40 year period from preconception. And I'm not just talking about women that are trying to conceive, I'm talking about young girls starting their periods right through to perimenopause. And iron requirements do change throughout each stage of life. But overall iron deficiency anemia impacts a whopping 1 in 4 women. And one of my colleagues and my sister weren't feeling quite right, feeling quite tired. And my sister actually had hair loss, and they both went to the doctors. They had blood tests, and blood tests came back as being normal. But after having some discussions with them, both of them started to take Activiion simultaneously, as per my recommendation, and their symptoms improved significantly. So just because their blood test results were normal, that doesn't mean that actually their ferritin levels were low, or they weren't symptomatic of having low iron. So that's a really important factor to consider as well. How women absorb iron, our different body weights, for example. our different diets. There are so many things that impact iron level. And something I learned recently was that we can actually lose iron through sweat. That I wasn't aware of either. So I thought that was really interesting. There are priority groups that as midwives, we work with these priority groups. So that's women trying to conceive, those that are pregnant, of course, and during the postpartum period. And I have a bit of a bugbear with us not continuing to recommend that women take their pregnancy supplements postnatally, because there's lots of surveillance around pregnancy, and rightly so, I understand that. But during the postpartum period, we have a whole really important time in a woman's life where she needs to prioritize her overall health and well-being in order to recover. And in Ayurvedic medicine, not that I'm, particularly well educated in it, but the little reading that I have done, they say that the first 40 days after birth impact the next 40 years of life. And I think that there probably is a significant amount of truth in that, because we know that if we don't treat certain problems during pregnancy and postnatally, that they can then become lifelong problems for women. So we have an opportunity to intervene, and just one simple conversation can make a huge difference. There are many dissatisfied iron users over this time, as I will talk about a bit later on, and there being a 50% lapsed use with traditional oral iron as well. So I wanted to include this slide because I think that it's quite unique and also rather impressive. Activiion are undertaking a clinical study in partnership with Ulster University, and iron supplementation during pregnancy has been shown, as I'm sure you're aware, but it's been shown to improve maternal iron status, of course, and some perinatal outcomes, such as reduced infant mortality and even pregnancy complications like below birth weight, preterm birth, and even postpartum hemorrhage. So this study that is being undertaken focuses on the impact of active iron and the different daily dosages of 25 milligrams and 50 milligrams throughout pregnancy and also at birth. The data is being collected at multiple time points. So they're collecting data at 12 weeks, 28 weeks, 36 weeks, and at delivery with the cord blood. And I think it is really important to collect data at those various different points. And I'm really intrigued and actually really excited to see the results. So the current status, they started recruiting just recently in June 2024. We'll continue to recruit throughout 2025, and there will also be a follow-up postnatal piece of research in January 2025 that, again, I'm particularly excited for, because I am really passionate about supporting mothers postnatally as well. So the role of supplementation in pregnancy: consuming the correct levels of the recommended nutrients for pregnancy through diet alone can be difficult. As Sheena mentioned at the beginning of this, it can be particularly difficult for women that are experiencing food aversions or nausea that's commonly associated with pregnancy. I normally eat a really clean and a really healthy, well-balanced diet. But both of my pregnancies, for the first 12 weeks, I could only manage beige, and that was bread, potatoes, pasta. It's all that I was actually able to stomach. I couldn't even look at a piece of spinach or broccoli. And many women share that experience, actually, of wanting to have beige foods. And there's, a whole school of thought that I won't go into around that, but it is really quite interesting. And it is believed that it's a protective factor as well to want to have those kinds of plainer foods early on in pregnancy. So supplements play such an important role in helping the nutritional support of mothers to stay healthy, but there are some key lookouts for supplementation for pregnancy in particular, but also for us in general. So it's important to look out for products that have clinical evidence to back up their claims. So companies can say certain things, or they can twist research to make it look a certain way, but having these kinds of clinical trials like Activiion that actually backs up what they're saying is really important when we're recommending products to women. Choosing supplements containing the best form of nutrients to maximize absorption, and active ingredients that result in the true nutritional benefits. So the body is actually having the opportunity to absorb it through greater bioavailability. So standard iron supplements can cause nasty gastrointestinal symptoms. I'm sure we're all well aware of how many times a woman's taking traditional iron, and she either comes to us and says, I'm constipated, it's giving me heartburn, it's making me feel sick, and I can't take it, or I'm reducing my dose. And they will tend to kind of self-medicate and kind of do their own thing with it, because it is really difficult for them to continue to take when they are also experiencing those symptoms anyway during pregnancy. As Sheena mentioned, progesterone slows down the digestive system. That can lead to constipation. And then if you're taking oral iron on top of that and then getting further constipated, it's no wonder 50% of women lapse use. And many of them reporting that the cure can actually be worse than the low iron or anemia itself. So it's important to choose an iron supplement with easy absorption that is non-constipating. As well, folate I mentioned earlier. Methylfolate is the biologically active form of folic acid, and it is more bioavailable. It doesn't need to be converted, so it is important as well to have those discussions and considerations when we are recommending supplements to women. The last thing I want to mention is time release. So this is an important one because many standard combined multivitamins often have considerably lower absorption rates, and that is because vitamins and minerals tend to compete with one another when basically they're all bunched together, and that can lead to poorer intestinal bioavailability and basically mums, not actually absorbing the nutrition. So moving on to the clinical evidence, as that was one of my first points to look out for. So Activiion's clinical evidence, it contains ferrous sulfate that's wrapped in a whey protein carrier, and this is actually patented. So you won't find any other product on the market that demonstrates the same. This protects the iron from oxidation in the stomach, and it delivers active iron to the most active site of absorption, which is in the small intestine. And this is really important if we're to support women to not get those usual GI side effects. And Activiion has been clinically tested and is, as I mentioned, part of an ongoing program of research. So just to quickly run through, their claims are all backed by research, 2 times better absorption, 2 times better compliance, and I don't doubt that's down to the 6 times less gut irritation, 94% increase in iron levels, and significant improvement in energy levels. So I think that's something many of us may need, definitely me anyway. So Activion's range for women's health. So Activion does have a range of products available to support women across all life stages. The mono iron is non-constipating, as I've already mentioned. It's wrapped in that whey protein, and it's clinically proven to increase iron and energy levels. It is safe to take during pregnancy, and as mentioned, it's currently being researched. We also have the active folate that contains the L-methylfolate, and this doesn't need to be converted, so it's really easily absorbed. And last, but certainly not least, the new Activion pregnancy product. It contains the same premium iron, but it has a special time-release multivitamin with all of the essential nutrients to support a healthy pregnancy. This product will be available towards the early November. So maintaining health and promoting well-being as healthcare professionals, it is of course important for us to consider, and we already do, the impact of pregnancy and postpartum on both the mental and physical well-being. So most women, they do go into pregnancy with low iron levels. Research shows that up to 20% of women have inadequate iron levels, and it is important that we share this information with women. Also, recovery times. I talk about this a lot online. Apparently, we use just as much energy as an endurance athlete as we do during training as we do to recover from birth. So that's, all of those internal organs going back to their usual place, the blood volume. There's so much going on physiologically for a mother after birth. Exercise may seem counterintuitive, but it can help to boost energy and keep joints mobile, reducing inflammation. And reducing inflammation is absolutely key for postnatal women as well. It's normal to cry and release emotions, as Sheena mentioned about, mental health during pregnancy and during the postnatal period. I think that we need to have that clear understanding and differentiation between baby blues and postnatal depression, because I have heard some mixed advice around crying after birth or, crying every day after birth. But it's really important that we understand it is normal to cry after you've had a baby, and it is also okay to do that. It's if it goes on for longer and it persists for longer than 2 weeks, that we need to look at interventions. But prior to that, I always encourage my women to have a cry with me if they feel they need to. It's a form of release, and research does actually demonstrate that it can reduce stress hormones. So yeah, I think it is important that we have that differentiation there. And we prepare women for postpartum recovery and make a postnatal plan. Again, I talk a lot about this. We have a lot of information and a lot of suggestions for women to make a birth plan, but it is just as important to make a postnatal plan. Again, they need to heal appropriately, they need to recover appropriately, and they need to still consider the nutrition and what they are putting into their body, and whether or not they may need to have any kind of supplementation to support them on their onward journey throughout motherhood, which is ever evolving and rather energy draining. I'm in the midst of it at the moment with sleep deprivation with my 1-year-old, and I actually still feel, you know, fairly fresh postpartum, but he's a whole year old now. So yeah, I think it is an ever evolving thing that we always need to be mindful of throughout our journey. So moving on to the summary, I'm just conscious of time, so I will fly through this. But promoting health and well-being throughout pregnancy is important, of course, for both mum and baby. Good nutrition has an important role to play in wellness during pregnancy, and supplementation can be a tool to support this. Not all supplements are created equally, and it's important that we remember this. Activiion is supported by clinical evidence, and it can improve and increase iron levels and also fight fatigue throughout women's life stages. Pregnancy has a significant physical and emotional impact on women. And so also, if you would like to try Activiion yourself, or if you would like a free sample, then please feel free to simply scan the QR code or visit the Healthcare Hub. If I do say myself, I really love the Healthcare Hub. There is lots of information on there. There are many interesting articles, and I have actually written a few, as I mentioned, white papers, one in particular around folic acid and folate that I really enjoyed researching and reading into myself. So yeah, please feel free to visit their hub for more information as well. And Sheena, I'll hand over to you because you've also got free access. Everyone loves a freebie. And I think it's so great, actually, that you're able to provide this for midwives. So yeah, of course, you've got access there, another QR code. So feel free, please, to head over and gain access there.
So this is, just to let everybody know, this is for maternity professionals, but if you're a mum, you want to look as well, then please do. But you can access this free online course on our hub. You can do it on your phone as well as on your laptop or gadget. So we've done this in collaboration with Activiion. So this is all for maternity and Activiion working together because we just really love their products too. So next slide, please. Oh, thank you for listening. Shall we leave the other one on just for the questions? Then people can get the QR code if they want to. This one, yeah, that's great. We've got a couple of questions, Mary-Louise, that have come through. One of them is about, so Sheila's asked, what part of the brain did I talk about? And that's the amygdala. So if you want me to spell it, it's just one moment. It's AMY.
Back to the slides.
DALA.
If you
it's AMY GDALA. AMY GDALA. And then the other question was for you, actually, Mary-Louise. It was, does vitamin D help body's defenses against cancer?
So I'm not an oncologist, so I'm not sure exactly the interaction that is at play with regards to cancer and, you know, in terms of the defense mechanism there. And what I do know from the research that I read was that many oncologists were reporting that their patients, if they were deficient of vitamin D, that the treatment wasn't successful at all, or it was nowhere near as successful. The actual interaction behind that, if I'm very honest, I'm not sure on. But you can go and have a look and have a read yourself of that. There's What I can do is actually, can I share links after? Because I can share some of the research papers around oncology and vitamin D. But yeah, just to summarize that, that's what the oncologist had said specifically. So there's now a real push for cancer patients to be tested for vitamin D levels to ensure that they are adequate. And this is a fairly new and recent finding, actually.
Great, thank you. And the next question, one of the next questions is around, well, this is the last question, is that we're getting a lot of questions from parents. Oh, wait a minute, there's two more questions. Getting a lot of questions from parents recently about alcohol-free drinks, e.g. 0% beer and wine. Is there any information that you're aware of that are not suitable in pregnancy? I don't know of any information. I think it's something you might have to look for online. If you Google it and have a look what that information is, because I think when I've read a lot about alcohol-free drinks, there seems to be absolutely no side effects. So it's just the alcohol taken out. Of course, there's sugar in there, but I'm not sure. I can't really give you proper information about that. Then another question is Activiion recommended when the person is anemic?
So when it's really actually, it really depends on their iron levels, and it really depends on the patient, and it really depends on their ability to tolerate the oil, the iron, oral iron that is traditionally prescribed. What I would say is it's really important to refer to your policy, to also refer to any senior members of staff, but bear in mind that when women do take traditional oral iron, 50% of them lapse use. So yeah, it's important to bear that in mind. However, there will be policies that will be important for you to understand and follow in relation to your specific hospital unit. What I'm talking more about today, I guess, is preventative measures, in particular around, up to 20% of women enter into pregnancy already anemic. There is now a more of a national push towards checking ferritin levels at booking, which I'm absolutely supportive of, because just because you're not anemic doesn't mean you won't very quickly become anemic. And once you are anemic, diet alone will not help to replenish your levels. So then we have this really kind of harsh and heavy dose of iron that women find very difficult to tolerate. So yeah, I think the preventative measures are really important. But I would always encourage you to ensure that you do look at the hospital policy and consider the unique individual needs of your patient.
That's a great answer. And I have to add to that as well, Mary-Louise, that, when you give information to women, pregnant women and postnatal women, and you give them this information that you have, but there's a question about that, about where the information is. Then it's up to them really what they do. I think you're not prescribing it or directing them to use it. You're telling them the information. Then it's up to them if they want to go and get it, isn't it? So it doesn't, so whilst midwives have to be aware of the maternity unit guidelines, women can do what they want. So you can just give them the information and they can do however they wish with that. We've had another question. Some pregnant ladies may want to see the proof of the clinical trials. So are they available? I guess they're on the hub, are they, Mary-Louise?
Absolutely, yeah.
So how do they get to that hub? Do they go to Activiion website?
Yeah, it's on the Activion's website. The reference to the paper is quoted there, so you can gain access to that yourself, and you can refer women to have a look for themselves as well. And interestingly, it will be good.
Fabulous.
To keep up to date with Activiion, because as I say, they're currently running that trial with Ulster University to demonstrate how Activiion impacts iron status of pregnant women at those various different stages during pregnancy. So that'll be a really interesting one to look out for as well.
Yeah, absolutely great. And then the last question before we finish is a great one from Sue, who's saying that she enjoyed the update, and she said she's saying, would we recommend Activiion for busy midwives too? And I would say absolutely. In fact, if there are any midwives, I don't know whether you want to put the slide back for the free sample, any midwives who want to try it for themselves, then please, go ahead and order it. I've used, I'm not working clinically, but I've definitely used it and loved it because it hasn't made me ill, sick. So, and it's had an impact on how I feel. So there you go. See, you just order some for midwives too, because, in your role working hard, you may need it as well. Anything to add on that, Mary-Louise?
Yeah, absolutely. So as we saw in the diagram, that we have a foundational need for iron as women throughout a 30 to 40 year period. So that's not just pregnant women, especially if you are bleeding every month. That is the leading cause of low iron. So yeah, I think it is really important for everyone to consider whether or not they are getting enough iron, and therefore consider supplementation.
Great. Thank you so much, everybody. Thank you for joining us today. And you will be able to watch this again. You'll have the link to watch it again. But Mary-Louise and I just want to say huge thanks to you all for joining, and also to Activiion for all the work that they're doing. And over to you, Mary-Louise.
Yeah, I second that, absolutely. Thanks so much for your time today. I know everyone is really busy. So thanks for watching and being here with us. And yeah, massive thank you as well for Activiion and enabling us to be here today, and for the products and the research and the hub that they also provide.
And a last thank you to Neil Stewart Associates, to the Maternity and Midwifery Forum for hosting this event. And very, very lastly, thank you to everybody, midwives, student midwives, obstetricians, anybody that's working in maternity care. Thank you for all you're doing, because we know that it's not easy, but you're doing a great job, and we're here to support you if you need us. So thank you. Thank you from the bottom of our hearts.